So, welcome to this session on popliteal fossa. The popliteal fossa is a popliteal fossa is a diamond shape. Okay, popliteal fossa is a diamond shaped depression behind the knee joint. And if we see the boundaries of popliteal fossa, the boundaries of the popliteal fossa are as follows. Now, suppose this is the lateral side. So superolaterally is biceps femoris muscle. Okay. Superomedially. So this is superomedially. SM is superomedial. That stands for semi-membranosus. And also on the semi-membranosus is semi-tendinosus. Okay. So these are the two muscles which are there superomedially and superolateral. Inferiormedially, or rather on the inferior aspect, we see the gastrocnemius muscle, the two heads of gastrocnemius. Okay. So inferiormedially is the medial head of gastrocnemius, and laterally is the lateral head of gastrocnemius, and there is one more muscle called as plantaris. Okay. So these are the structures which are forming the boundaries. Superolaterally, biceps femoris; superomedially, semimembranosus and semitendinosus. Inferiormedially is the medial head of gastrocnemius. Inferiorlaterally is the lateral head of gastrocnemius and plantaris. Before talking about uh, the roof of this, I would like to talk about the floor first because I'm going to show it in the same diagram. The floor from above downwards is formed by three structures. One is, see, above will be femur, here will be tibia, and in between will be the knee joint. Okay. So this part of the floor is formed by the popliteal surface of femur. Popliteal surface of femur. Middle part is formed by the capsule of the knee joint and especially the oblique popliteal ligament. Okay. And the oblique popliteal ligament. And the lower part is formed by the posterior surface of the tibia, upper part. But then on that will be the popliteus muscle. Okay. So the popliteus muscle covered by popliteal fascia. Okay. Covered by popliteal fascia. In this part also, in the popliteal surface of the femur, which we said, here there is a fat. Okay. In this region there is fat. In this region there is popliteus muscle, and popliteus muscle is covered by popliteus fascia. Here is capsule of knee joint, and then there is the oblique popliteal ligament. So there are two structures: popliteal surface of femur covered with fat, capsule of knee joint, especially oblique popliteal ligament, and popliteus muscle covered by popliteal fascia. Now let us talk about the structures in the roof. So if this is the popliteal fossa, in the roof we find, now let's firstly define which side is what. So in the roof, suppose this is the medial side and this is the lateral side. In the roof, lying in between is the small saphenous vein. Small saphenous vein. Okay. And then there is the posterior division of medial cutaneous vein. Then there is the uh, posterior cutaneous nerve of thigh. Okay, the posterior cutaneous nerve of thigh, which is not on this side. Okay, posterior cutaneous nerve of thigh. Posterior cutaneous nerve of thigh. Also, there is peroneal communicating nerve. Peroneal communicating nerve. Okay, so there are in total four structures, out of which one which form the roof of the popliteal fossa, of which one is a vein, small saphenous vein. Then there is um, the peroneal communicating nerve, posterior cutaneous nerve of thigh, and the posterior division of the medial cutaneous nerve. So this is about the roof. These are the boundaries. This is the floor. Now we go on to the next component, and that is the contents. So contents we can very easily talk about. Normally we have seen this in axilla also, axilla, axillary pad of fat, axillary artery, axillary vein. So similarly here there is popliteal is our keyword, popliteal artery and its branches, right? Popliteal vein and its tributaries, right? And now at the superior angle the of this popliteal fossa, the sciatic nerve divides into tibial nerve and the common peroneal nerve. So therefore we'll find tibial nerve and its branches, common peroneal nerve and its branch. Okay. Then there is this posterior cutaneous nerve of thigh, which is more in the root. And then there are genicular branches of obturator nerve. Genicular branches of obturator nerve, that is the posterior division. Okay. Then there are popliteal lymph nodes. Popliteal lymph nodes. And of course, there is the fat. Okay, so total eight structures: popliteal artery and its branches, popliteal vein and its tributaries, tibial nerve and its branches, common peroneal nerve and its branches, posterior cutaneous nerve of thigh, fat, genicular branches of obturator nerve, popliteal lymph. Okay, so these are the structures. Now, one more thing which we should be knowing about these structures is that in the upper part of the thigh anteriorly, we saw that a nerve was lateral, artery was in between, and then vein was on the medial side. As we went down, the artery was almost crossing the vein. Okay, this we are talking about femoral artery and femoral vein and the femoral nerve. Femoral nerve, of course, just gave a saphenous branch which was here. Now what happens is the artery has already come on the medial side. Now when we look from the posterior aspect, the artery is there on the medial side. The vein is there, and tibial nerve, and the tibial nerve is slightly lateral compared to these three structures. So this is in the upper one third of the popliteal fossa. Now what happens is, as we go lower down, the artery, so in the upper one third, in the upper one third from medial to lateral side is artery, vein and tibial nerve. The popliteal artery, popliteal vein, tibial nerve. In medial, in the middle, what happens is we have to talk about anterior to posterior. Most anterior is popliteal artery, then is popliteal vein, and then is tibial nerve, which is most superficial. Okay, and in the lower one third, what happens is there is popliteal artery, which when we talk about medial to lateral side, you see here the tibial nerve, which was lateral, has now come medial. So tibial nerve, popliteal vein, and popliteal artery. Okay, so artery was medial in the upper one third, and in the lower one third, the artery becomes lateral. Tibial nerve was slightly lateral structure and now become the medial structure. Okay, this is how these structures uh, cross. Okay, but if you see integrated, if you want to see an integrated diagram of all of this uh, with artery on the medial side. Suppose the artery just entering, okay, artery just entering from the medial side. Now this is the medial side, okay, this is the artery, and then the vein is slightly lateral. So the vein becomes like this, okay, this is vein. So this is medial side in this diagram, and this is the lateral aspect, okay. And sciatic nerve divides here. Sciatic nerve comes and divides here into tibial nerve and common peroneal. So common peroneal goes like this laterally, and tibial nerve comes on the medial aspect. So this is what we say. In the upper one third from medial to lateral side is artery, vein, and nerve. In middle one third anterior to posterior is artery, vein, and nerve. And in the lower one third from medial to lateral side is nerve, nerve, vein, the tibial nerve, popliteal vein, and popliteal artery. Okay, so this is the most important relation we need to know in the as regards the popliteal fossa is concerned. These three structures in upper one third, artery is medial, and in lower one third, artery becomes lateral. Okay. Now coming to the popliteal artery. Now this popliteal artery is a continuation of the femoral artery. Okay, femoral artery pierces the adductor magnus muscle, and that's how it becomes continuous as popliteal artery. Okay, this popliteal artery passes from the medial to the lateral aspect, and it gives some important branches in the popliteal fossa. Now, what are these important branches? These branches are called as genicular branches. So, as the artery is going from lateral to medial side, it gives genicular branches. Now, this is medial side and this is the lateral side. So, superior medial genicular artery, superior lateral genicular artery, inferior medial genicular artery. See, these all supply the knee joint. Inferior lateral genicular artery. Okay, and then there are there is a branch called as middle genicular artery. This middle genicular artery pierces the oblique popliteal ligament and the capsule of the knee joint, and it supplies the intra-articular structures. It supplies the intra-articular structures of the knee joint. Okay. Popliteal vein, as regards the popliteal vein is concerned, it mainly receives a small saphenous vein. Like we have the dorsal venous arch, the medial end of dorsal venous arch starts the saphenous, great saphenous vein, and from the lateral end starts the small saphenous vein, and this small saphenous vein ends in popliteal vein in the popliteal fossa. Okay. As regards the uh, tibial nerve is concerned, the tibial nerve will give branches more on the medial aspect. So it will give superior medial genicular nerve, then inferior medial genicular nerve. Like the common peroneal, because it is on the lateral aspect, it will give superior lateral genicular nerve and inferior lateral genicular nerve. But tibial nerve, in addition to this, will also give middle genicular nerve. Will also give middle genicular nerve. It gives a cutaneous branch called as sural nerve. Okay, the sural nerve is a cutaneous branch, and this supplies the skin on the lower half of the back of the leg. Okay, and it will supply muscles also. The muscles, that is the gastrocnemius, the plantaris, and the popliteus. Okay, gastrocnemius separate branch for the medial, separate branch for the lateral head, plantaris, and popliteus. While the common peroneal will give superior lateral genicular, inferior lateral genicular branch, a recurrent genicular branch, and it also gives a cutaneous branch called as lateral cutaneous nerve of the calf. Okay, and it gives, like this gives a sural nerve. cutaneous gland. This gives sural communicating nerve. Okay, it gives a sural communicating nerve. As regards its muscular branches, like this was supplying gastrocnemius and plantaris and popliteus, this supplies the common peroneal nerve. It supplies the small head of biceps femoris. It supplies the small head of biceps femoris. As regards the applied anatomy of the popliteal fossa is concerned, this popliteal fossa can be used for, feeling the pulse, okay, of the pulse of the popliteal artery, the BP of the lower limb. Blood pressure in the lower limb can be measured. Sometimes the blood pressure in upper limb and lower limb are different in case of coarctation of aorta after the axillary artery and subclavian artery is given. So the aorta may show coarctation. That in that case, the blood pressure in the lower limb will be higher. Okay. Uh, Blood pressure in the upper limb will be higher in that case of coarctation of aorta. Okay. So we have to see the blood pressure in the lower limb also. So that can be seen in at the popliteal artery. Okay. Popliteal artery, because it is fixed to the knee capsule, constantly there is traction and stretching of this artery, and therefore this can lead to thrombosis of the popliteal. Okay. So that's about the applied anatomy. You can write about it. Popliteal pulse can be felt, BP of the lower limb can be taken, and the thrombosis of the popliteal artery is seen because of the constant friction with the knee joint. So that's all about the popliteal fossa. Thank you so much.